When was the last time you climbed stairs without holding the railing, or enjoyed a neighborhood stroll without worrying about your balance? Did you know that 32% of Americans over 70 will experience a serious fall this year, but it's often not age that's to blame? The real culprit behind weakening legs is usually specific nutrient deficiencies that no one talks about. As someone who's worked with hundreds of adults in their 70s, 80s, and even 90s, I've seen firsthand how simple nutritional changes can restore stability and confidence. Every day you wait to address these deficiencies is another day your independence is at risk. In this video, I'll share 6 essential vitamins that can transform your mobility. Nutrients many doctors never discuss with their older patients. If you're concerned about maintaining your independence, please tap the like button and subscribe for more practical health advice. Have you noticed changes in your leg strength recently? Share briefly in the comments. Now, let's explore the first critical vitamin for keeping your legs strong. 1. Vitamin D, the foundation of stability. Vitamin D is the cornerstone of leg strength and stability for adults over 70. This powerhouse nutrient doesn't just support bone health, it's essential for proper muscle functions and nerve signaling throughout your legs. According to the National Institute on Aging, vitamin D deficiency affects up to 61% of Americans over 70, far higher than in younger adults. This is particularly concerning because low vitamin D levels directly link to a 30% increase in fall risk. Why does this happen? As we age past 70, our skin produces up to 75% less vitamin D from sunlight than it did in our youth. If you remember watching the moon landing live or the arrival of color television, you grew up in an era when outdoor activities were common and food was less processed. Today, those same habits aren't enough to maintain healthy vitamin D levels. The signs of vitamin D deficiency often get dismissed as normal aging. Notice difficulty rising from your favorite chair without using armrests? Feel unsteady on slight inclines? Find your legs tiring unusually quickly during routine activities like grocery shopping? These are warning signs, not inevitable aspects of getting older. A Harvard Medical School study found that adequate vitamin D supplementation reduced fall risk by 23% in seniors within just 12 weeks. For best results, look for vitamin D3 supplements, the form your body uses most efficiently, with the USP verified mark. This independent certification ensures you're getting exactly what's on the label. Important note for those taking medications: heart medications like statins and blood pressure drugs can affect how your body processes vitamin D. Many of these interactions aren't discussed during routine doctor visits. During your next doctor's appointment, specifically request a vitamin D blood test. Many Medicare Advantage plans now cover this important screening. Have you had yours checked in the last year? A simple thumbs up in the comments lets us know you're taking this seriously. Now that you know how to strengthen your muscles with vitamin D, let's look at what makes those muscles respond properly. Think of vitamin B12 as the communication system for your legs. Without it, even the strongest muscles can't get the message to move. Vitamin B12 plays a critical role in maintaining the connection between your brain and your leg muscles. Without it, even the strongest muscles can't respond properly to signals from your nervous system. What many doctors don't emphasize is that between 20 to 30% of Americans over 70 have difficulty absorbing B12 from food. This isn't due to poor diet, it's because our bodies produce significantly less stomach acid and special stomach protein that helps absorb B12 as we age. According to the Mayo Clinic, B12 deficiency can cause weakness, tingling in the legs, and balance problems that are frequently misdiagnosed as normal aging or even early dementia. These symptoms occur because B12 maintains the protective coating around your nerves, like insulation on electrical wires. When this protection thins with age or deficiency, signals to your leg muscles become delayed or disrupted, causing weakness and instability that can dramatically affect your confidence and independence. Do your legs sometimes feel like they're not quite under your control? Or perhaps you've experienced that frustrating pins and needles sensation more frequently, especially when sitting through your favorite television programs or church services. If you take common medications like metformin for diabetes, acid reflux medications like Prilosec, or certain blood pressure medications, your B12 absorption may be further compromised, a fact many healthcare providers don't discuss with their patients. Dr. Mark Hyman, director of the Cleveland Clinic Center for Functional Medicine, recommends under-the-tongue B12 supplements for adults over 70, as they bypass stomach acid altogether and enter the bloodstream directly. Eleanor, a 76-year-old retired nurse from Pennsylvania, noticed her legs becoming increasingly unsteady when standing for hymns at church. After 3 months of B12 supplementation, she regained the confidence to serve as a greeter without fear of falling. After this video, take 3 minutes to check your medicine cabinet. If you use acid reducers or diabetes medications, place a note there to ask your doctor about B12 testing. Has anyone mentioned B12 to you before? Let us know in the comments. Let's take a brief stretch break. If you're able, gently stand up and march in place for 10 seconds. If seated, rotate your ankles in circles. This small movement helps circulation and memory retention. With your muscles powered by vitamin D and your nerve signals working efficiently, thanks to B12, we need to address what holds everything together. Vitamin C does much more than fight colds. It's like the glue that keeps your leg structure intact. While most people think of vitamin C only for immune support, it's actually essential for maintaining the structural integrity of your legs. This versatile nutrient produces collagen, the protein that strengthens your tendons, ligaments, and the cushioning cartilage in your knees and ankles. Research from Tufts University found that adults with higher vitamin C levels maintained up to 20% more muscle mass as they aged past 70. This connection between vitamin C and muscle preservation is particularly important for maintaining independence. If your knees feel stiff when standing up from your favorite chair, or if walking up the steps at church or your grandchild's school events has become painful, your body may be signaling the need for more vitamin C. Many Americans born in the 1940s and 50s grew up with orange juice as their primary source of vitamin C. However, there are actually more potent sources. Red bell peppers contain 3 times more vitamin C than oranges, and strawberries provide your entire daily requirement in just 1 cup. An important consideration for those taking medications: daily aspirin use, common among adults over 70, and certain blood pressure medications can lower vitamin C levels over time, something to discuss with your doctor. Dr. Sarah Wilson at the National Institute on Aging recommends 250 to 500 milligrams daily for adults over 70, somewhat higher than the standard recommendation, reflecting the increased needs of aging bodies. Since vitamin C is water-soluble and doesn't store in your body, taking smaller doses twice daily can be more effective than a single large dose. For those with sensitive stomachs, look for stomach-friendly vitamin C supplements, which are gentler on the digestive system. If you have a loved one helping with your shopping, consider showing them this section about vitamin C-rich foods to add to your grocery list. What's your favorite vitamin C-rich food? Share in the comments. You might inspire someone else's grocery list this week. Let's take a quick check-in moment. Are you finding this information helpful so far? Give yourself a moment to absorb what we've covered about these first 3 critical nutrients. Let's pause for a brief review. So far, we've learned that vitamin D forms the foundation of muscle strength. Vitamin B12 serves as the communication system for your nerves, and vitamin C acts as the glue that holds joints and tissues together. Together, they create the first half of our leg strength solution. take another 10-second break to wiggle your toes and rotate your ankles. This small movement helps your circulation and reinforces what you're learning. Now that we've covered your muscles, nerves, and connective tissues, let's talk about your foundation, your bones. This is where vitamin K2 becomes critical, yet it's the nutrient most doctors never mention. Vitamin K2 might be the most overlooked nutrient for leg strength in adults over 70, yet it plays a crucial role in maintaining the bone framework that supports your legs. Here's a surprising fact. Americans consume more calcium supplements than almost any other nation, yet still have among the highest rates of osteoporosis. The missing piece? Vitamin K2. Doctor Michael Hollick of Boston University describes K2 as the traffic director for calcium, sending it to your bones where it belongs, instead of allowing it to accumulate in arteries or joints. Without sufficient K2, the calcium you consume may not reach your bones effectively, leaving them vulnerable to fractures. Have you noticed your posture changing or your height decreasing slightly? These subtle changes can signal that calcium isn't being properly directed to your bones, regardless of how much calcium you consume. This is particularly relevant for Americans in their 70s and beyond, as bone density loss accelerates after 70, with women losing up to 2% of bone mass yearly and men about 1%. A critical warning for medication safety. If you're taking blood thinners like warfarin, Coumadin, it's essential to talk with your doctor before supplementing with K2, as they can interact. This affects many older Americans, as approximately 25% of those over 75 take prescription blood thinners. While fermented foods like natto contain the highest amounts of K2, many Americans prefer more familiar options like aged cheeses, pastured egg yolks, and grass-fed butter. For supplements, look for the special long-lasting form of K2, which remains active in your body for up to 72 hours, providing more consistent support for your bones. Has your doctor ever discussed vitamin K2 with you? This might be a question worth asking at your next checkup. Let us know in the comments if K2 is new information for you. So far, we've learned that vitamin D strengthens muscles, B12 ensures proper nerve function, C maintains connective tissues, and K2 builds strong bones. Now let's discover the nutrient that helps your muscles both energize and relax. Magnesium is often called the relaxation mineral, playing a vital role in both energizing your leg muscles and helping them relax properly. This balance of contraction and relaxation is essential for smooth, coordinated movement. A surprising 68% of Americans over 70 don't meet the recommended daily intake of magnesium, a deficiency that directly impacts leg strength and function. Our reliance on processed foods combined with soil depletion in American farmlands has created what researchers call a magnesium crisis affecting our aging population. If you remember the home-cooked meals of the 1950s, you were likely getting significantly more magnesium than from today's convenience foods. The change in our food supply has happened gradually, but the impact on our health has been substantial. Research from the University of Michigan found that magnesium supplementation improved walking speed and reduced fall risk by 43% in seniors who previously experienced leg cramps. Do you experience nighttime leg cramps that wake you from sleep? Or perhaps restless legs that make it difficult to sit through your favorite TV shows? These common complaints often respond remarkably well to improved magnesium levels. It's important to know that many medications commonly prescribed to older Americans can deplete magnesium. Water pills for high blood pressure, certain antibiotics, and acid-reducing medications can significantly lower your magnesium levels over time. For those looking to increase magnesium through diet, consider foods that have been staples for your generation. Dark chocolate isn't just a treat. A 1-ounce square of 70% dark chocolate provides about 65 milligrams of magnesium. Pumpkin seeds, another American favorite, are an excellent source as well. For supplements, Dr. Mark Hyman from the Cleveland Clinic recommends magnesium glycinate for seniors due to its higher absorption rate and gentle effect on the digestive system. Start with a lower dose and increase gradually to avoid digestive discomfort. Robert, a 78-year-old retired teacher from Texas, had nearly given up his morning walks due to persistent calf cramps. Within 3 weeks of adding magnesium, he was back to walking a mile every morning. Have you experienced nighttime leg cramps? What has worked for you? Your experience could help someone else find relief. Another quick stretch break. Take 10 seconds to gently stretch your legs if standing, or do seated ankle rotations if sitting. These small movements help prevent stiffness while watching longer videos. We've now built strong muscles, ensured proper nerve function, maintained healthy joints, supported bone density, and balanced muscle energy. But there's one more crucial element, making sure all these nutrients actually reach your leg tissues. This is where our final vitamin becomes essential. Vitamin E is the unsung hero of leg strength for adults over 70, ensuring proper circulation that delivers oxygen and nutrients to your hardworking leg muscles. A Stanford University study found that adults with higher vitamin E levels could walk an average of 342 feet farther without stopping than those with lower levels. This remarkable difference highlights how important circulation becomes as we age. Vitamin E acts as a natural blood thinner and protects your blood vessels from oxidative damage, like rust-proofing the pipes that deliver vital resources to your leg muscles. Without adequate vitamin E, circulation to your extremities can diminish, leading to coldness, fatigue, and weakness in your legs. Do your legs feel cold, especially in your feet, or unusually tired after minimal activity? These are classic signs of reduced circulation that vitamin E may help address. For the 34% of Americans over 70 managing type 2 diabetes or prediabetes, vitamin E is particularly crucial, as these conditions can significantly impair circulation to the lower extremities. The FDA cautions that vitamin E supplements can interact with blood thinners like warfarin or daily aspirin therapy. Always consult with your healthcare provider if you're on these medications. A lower dose of vitamin E may still be beneficial under proper supervision. Many Medicare plans now cover nutritional consultations where you can discuss these interactions safely. Sunflower seeds, almonds, and avocados are all excellent sources of vitamin E that can be easily incorporated into your daily diet. Many Americans who grew up in the 1940s and 50s remember when these foods became popular additions to the American diet. For supplements, look for products containing the complete vitamin E family rather than just one component, as this combination better reflects vitamin E as found in whole foods and provides more complete protection. James, a 76-year-old retired postal worker from Atlanta, found that adding vitamin E-rich foods to his daily soul food recipes improved circulation to his legs significantly. Meanwhile, Maria, an 82-year-old grandmother from Arizona who migrated from Mexico in her youth, incorporated sunflower seeds into her traditional dishes and noticed less coldness in her feet within weeks. If you found this information valuable, especially about vitamin E, please consider watching this video with a family member who helps with your care. They can help you implement these suggestions safely. Now that we've explored all 6 essential vitamins, you might be wondering where to begin. The answer depends on your specific symptoms. For general leg weakness and fatigue, start with vitamin D. For tingling, numbness, or poor coordination, focus on B12. For joint pain and stiffness, begin with vitamin C. For bone health concerns, add K2. For nighttime leg cramps or restless legs, try magnesium. For cold legs or quick fatigue when walking, vitamin E might be your priority. Most people over 70 notice the quickest improvements with vitamin D and magnesium. However, remember, these nutrients work as a team. Like a house needs both a foundation and a roof. Your legs need all 6 vitamins to function optimally. Mrs. Wilson from Florida started with just 1 vitamin and gradually added others. Now she can play with her great-grandchildren without worrying about her balance. Many of my clients in their 70s, 80s, and even 90s have reported similar improvements within 4 to 6 weeks. While nutrition is powerful, it works best alongside your doctor's recommendations, especially if you're taking medications that might affect nutrient absorption. Which vitamin seems most relevant to your situation? Let us know in the comments. And if you know someone who struggles with leg weakness, sharing this video could be the gift of mobility they need. If you have a loved one helping with your care, consider watching this video together during your next visit. Their support can be invaluable in implementing these nutritional strategies. Thank you for watching. Remember, your independence and mobility are worth fighting for, and sometimes the solution is simpler than you might think.